Namaskar everyone, I am Dr. R.K. Singh, a senior ENT and head neck surgeon working at Apex Hospital in Rewari, Haryana, and I welcome you all to my YouTube channel. Today we are going to discuss a very vital topic, which is Introduction to Inner Ear Disorder. Let's get started into the topic. The inner ear disorders affect our balance, hearing and overall well-being as well as our quality of life. The inner ear is a complex structure responsible for both hearing and balance. Disorders affecting the inner ear can have a significant impact on an individual's quality of life, causing symptoms like hearing loss, vertigo, and imbalance. In this talk, we will explore common inner ear disorders and the underlying causes, symptoms, diagnosis, and the various treatment options in those disorders. Before going ahead, let us first understand the anatomy or structure of the inner ear, which is pretty complicated. The inner ear comprises of delicate structure including cochlea, responsible for hearing, and vestibular system, which is responsible for the balance. The cochlea contains sensory hair cells that convert sound vibrations into electrical signals, which are and then transmitted to the brain in the auditory nerve. The vestibular system consists of three semicircular canals and otolith organs which detect head movements and change in position of the head. Common inner ear disorders are number 1, Meniere's disease, which is a disorder characterized by episodic vertigo, fluctuating hearing loss, tinnitus, that is ringing in the ear, and a feeling of fullness in the affected ear. It is believed to result from an abnormal buildup of fluid in the inner ear, that is the increased pressure of this fluid in the inner ear, also known as endolymphatic hydrops, and causes disturbances in the balance and hearing. Episodic of vertigo may be severe and disabling, often accompanied by nausea and vomiting. Number 2 disorders are benign paroxysmal positional vertigo, that is in short form BPPV, which is a common vestibular disorder characterized by brief episodes of vertigo triggered by change in head position such as turning over in the bed or looking up. It occurs due to displacement of calcium carbonate crystals, also known as otoconia, within the semicircular canals, leading to abnormal stimulation of vestibular system. Symptoms typically last for few seconds to a minute and may be accompanied by nausea and nystagmus. Nystagmus is an involuntary eye movement which happens in BPPV. Number 3 are labyrinthitis and vestibular neuritis. Labyrinthitis and vestibular neuritis are inflammatory conditions affecting the inner ear, resulting in acute vertigo, nausea, vomiting, and imbalance. Labyrinthitis involves inflammation of the labyrinth, including the cochlea and the vestibular system, often associated with viral or bacterial infection. On the other hand, vestibular neuritis specifically affects the vestibular nerve, causing sudden onset of vertigo with hearing loss, without hearing loss, or tinnitus. Diagnosis of inner ear disorders involve a comprehensive evaluation by an ENT surgeon and an audiologist. This may include detailed medical history, physical examination, audiometric testing like hearing test, audiometry, vestibular testing, example caloric testing, and video nystagmography, and imaging studies like MRI to rule out the causes. Treatment options include number 1, medications such as vestibular suppressants, example penicillin, Antiemetic drugs like dimenhydramine and corticosteroid may be prescribed to alleviate the symptoms during the acute episode. Number 2 is vestibular rehabilitation, which is a specialized exercise program designed to improve balance and reduce symptoms of dizziness and vertigo. It involves exercises that promote adaptation and compensation of vestibular deficit, as well as the strategies to improve the gaze stabilization and postural control. Number 3 are surgical interventions. In some cases, surgical intervention may be considered for refractory or severe inner ear disorders. Procedures such as endolymphatic sac decompression, vestibular nerve section, or labyrinthectomy may be recommended to alleviate these symptoms and improve the quality of life. Number 4 are lifestyle modifications such as dietary changes, that is reducing salt intake, stress management techniques, and avoiding triggers, example like caffeine and alcohol, may help manage symptoms and reduce the frequency and severity of the episode. To conclude, inner ear disorders can significantly impact an individual's daily function and quality of life, affecting both hearing and balance. Early diagnosis and appropriate management are essential for optimizing treatment outcomes and minimizing long-term complications. By understanding the underlying causes, symptoms, and treatment options for common inner ear disorders. Symptoms vary depending upon the disorder but may include dizziness, ringing in the ear, that is tinnitus, and hearing loss. Cause can range from infection to aging and underlying health condition. Individual can take proactive steps to manage the condition and improve the overall well-being and the quality of life. Thank you so much for joining me today to learn about the inner ear disorders. If you have any questions, query, or suggestion, and anything which you like to share, please leave this in a comment box below, and don't forget to subscribe our channel for more educational content like this, and please give this video a thumbs up if you found it helpful.